Welcome to End of Life University on YouTube. Today I'm sharing with you an audio-only interview from the archives of the podcast from a couple of years ago. And this is a conversation I had with Amy Wright Glenn and Nicole Heidbreder about grief work for healthcare providers. And this conversation did take place during 2020, during the first year of COVID. So we talk a bit about COVID, but I still felt like this content is really relevant for us to hear today. So I'm reposting it here for you, and I hope you enjoy it. Don't forget to subscribe to this channel down below. Also subscribe and follow the podcast wherever you happen to listen, and leave a rating and review. It's very helpful. Also, if you're willing to chip in a few bucks a month to keep the podcast on the air, go to eoluniversity.com/support and find out how you can step up and become a patron. So we'll move on with my conversation with Amy Wright Glenn and Nicole Heidbreder. Here we go. Hello, everyone, and welcome to End of Life University podcast, where we share real talk about life and death. I'm your host, Dr. Karen Wyatt, and this is episode number 243, titled Grief Work for Healthcare Providers, and I'll be sharing an interview with you in just a few minutes. But first, I want to send you greetings from my quarantine home to your quarantine home, as we're all here in our little cocoons waiting out the global pandemic of coronavirus. And I just want to say, I celebrated my birthday yesterday, the day before I'm doing this recording, and I can attest that you do not have to be physically present with people in order to feel loved by them. I had a fabulous day. I wasn't sure how my birthday would go, but it was wonderful and beautiful. I received just so many wonderful wishes. I felt bathed in love all day long, and I'm so grateful to everyone who reached out to me and were part of my celebration, even in the midst of a quarantine. So never doubt, as I've said before, that love is not limited by time and space, and we don't have to be in the same room, in the same city, in the same state, or the same country, probably even the same universe, in order to feel love. And I just want to thank everyone out there who reached out to me. Before I get started with the interview today, which is with Nicole Heidbreder and Amy Wright Glenn, and we're going to be talking, as I said, about grief work for healthcare providers, just a couple of reminders for you. One is, if you go to the show notes, EOLUpodcast.com. That is the website for all the show notes of all of the podcast episodes I've ever done. And you'll find links for anything I've talked about or mentioned online, or that my guests have mentioned during our interviews. You can look up previous episodes and listen to them there. And it can be a helpful place to land if you're looking for more information. So you can go there, eolupodcast.com, scroll through past episodes and today's episode included for anything you're looking for. And one link you'll find in today's episode and several others is a link to my course on advanced directives that I have made totally free for anyone who wants a step-by-step approach and needs a little encouragement to actually get their advanced directives done. And you'll find the link where you can go. You don't need to enroll, subscribe, pay anything, enter your email address, nothing. You'll just go to a web page and all the modules are there if you're interested. So you'll find that link in the show notes. Also, a reminder that I am now posting a weekly bonus called Love Over Fear, Stories for Precarious Times. These are brief stories I'm sharing with you, heartwarming, inspirational stories. And those are in between each one of these episodes of the podcast. You can find those in the show notes too. Also, if you are a subscriber through a podcast app like Apple Podcasts, Stitcher, Spotify, Google Podcasts, these stories will appear within the episodes listed in your podcast app. So you can find them there. So if you're looking for just a 15 or 20 minute little story, check out Love Over Fear. Also, on April 9th, I posted a vigil for ailing loved ones when we can't be together. And once a month, the 9th of each month, I'll be posting additional vigils. And so if you're looking for something that can help you feel connected to someone who's distant from you, who might be sick right now, or even perhaps dying in a hospital where you cannot visit or can't make contact, this vigil might be something that you'll find comforting, but also a way for you to get yourself into a space of contemplation where you can send out your love and your compassion to the person that you're thinking about. So that was on April 9th. And again, you'll find it at eolupodcast.com. So go there and check out those previous episodes. Next, I want to give you a prompt for journaling this week. I've been doing that every week just because I encourage people, if you are spending time at home and you have a little extra time, it's a really good time to start reflecting and contemplating your life and your inner world a little bit. So I'm giving you some prompts and things that you could write about in your own journal. And I wanted to share a quick little story on, I think it was on Stephen Colbert's show this week. I heard him interview an astronaut, Christina Koch, who has just returned to planet Earth after spending 11 months on a mission in the space station. And she talked about what it's like to live in the small, crowded space of a space station, being isolated apart from all the people that she loves and cares about, doing work on the space station, and how she kept herself sane and positive and hopeful and not falling into despair while she spent this extended period of time, 11 months in the space station, which I think is kind of applicable for those of us who are quarantining in our own homes right now and feeling that same kind of isolation and separation. And she said, whenever I would start thinking about something that I really missed or wished that I had, and she used the example of like, oh, I wish I could go get a latte right now. I'm so sad that I can't do that. She said, I would turn that around and think of, what do I have right now being here on this space station and in space that one day I'll miss when I am back on Earth drinking my latte? What's something that I have right now that I won't have in the future? And so I think that's a great way to think about it. There's so many things that we're missing right now as we're going through quarantine and staying at home, not going to the workplace, not socializing with our friends, not even, the places where we would go for exercise or coffee or go to read books, go shopping or view an art gallery. We're missing all of those things in our lives. And I think she had great advice. Rather than get stuck dwelling on what we don't have right now, be grateful for some of the things that we do have right now because of this quarantine and because we're ensconced in our little cocoons at home. What do I have right now that I might miss one day when this is over with and when I'm not in this situation anymore? And for me, one example of that is I will miss the pure joy of going outside for a walk each day, which in the past I have kind of taken for granted opportunities to go for walks and not even really appreciated how wonderful it is that I have strong, healthy legs that I can walk on and a safe place where I can go out for a walk and be outside in the sunlight and see nature and even just walking through my neighborhood. And so I'm going to miss how pleasurable these walks are in the future when I have lots of other options for getting exercise. And so that's just one thing. So maybe that's something to reflect on each day. What am I going to miss about being in my home quarantine situation? So we'll get on with my interview with Nicole Heidbreder and Amy Wright Glenn, talking about grief work for healthcare providers, which is one of the topics I'm very passionate about. So as always, stay tuned after this interview. I'll come back for just a few takeaways and to say goodbye. So here we go. Today, I have the pleasure of welcoming two guests to the podcast, and I'm really excited about the conversation we're going to have. I'll be speaking with Amy Wright Glenn, who has been a teacher of religion and philosophy, as well as a Kripalu yoga teacher and a prenatal yoga teacher trainer. She is a birth doula, hospital chaplain, founder of the Institute for the Study of Birth, Breath, and Death, and the author of two books, Birth, Breath, and Death, Meditations on Motherhood, Chaplaincy, and Life as a Doula, and Holding Space on Loving, Dying, and Letting Go. And you can learn more about Amy's work at her website, birthbreathanddeath.com. And also joining Amy and me is Nicole Heidbreder, who works as a labor and delivery and hospice nurse in the Washington, D.C. area and has been attending births as a doula for over 15 years. In addition to birth doula workshops, she also teaches end-of-life doula workshops for the International End-of-Life Doula Association. And Nicole's website is gracefulfusion.com. Nicole and Amy are currently co-teaching a course on grief work for healthcare providers, which we'll be discussing as part of our conversation today. And I want to welcome both of you. Thanks so much for joining me.
Thank you so much, Karen.
Yeah, thank you, Karen. It's a real pleasure to be with you. Thank you.
Yes, you're welcome. I'm excited to learn more about your workshop. But first, before we really get into it, I just wanted to check in with each one of you. It's April 2020, and we're in the middle of the COVID-19 pandemic and the lockdown in all of our communities. So I just wanted to ask you, Amy, how are you doing? How are things going where you live? I know you live in Florida. How are things going for you right now?
Thank you so much for checking in. It really models such a compassionate awareness that we're all in this strange and interesting time and difficult time together. So for me, I'm a mom of an 8-year-old, and his schoolwork is now here with me, and his teachers have been remarkable. It's been such a seamless shift due to their grace and grit and determination. And we live gratefully near a very large golf course, which has now been closed to golfing, but now is open to biking and walking. And it's big and it's vast, and it's giving us lots of spaciousness in the day to leave our apartment and go play Narnia under the trees and go for long bike rides. So I'm very grateful for that open space. And gratefully, we are healthy. I am engaged, and my fiance is also healthy and well, and his work has allowed him to shift to work from home. And since my work had already been from home, the shift for me is more of a sense of stacking lives on top of each other, if that makes sense. It's like a powerful case of cabin fever where we deeply love each other and we're very connected. And there's a deep wonder in this time, but there's also the alchemy of pressure that all of our schedules are stacked on each other. And so we have sometimes friction that's normal through that, but also a lot of, I guess, a sense of being very close, so close. So I would say to you, I'm doing well. My family's doing well. And we are doing our best to make a difference in our community, especially through my work with Nicole on this topic. It's a way for me to channel some of that concern I have for our world and our community into my work.
Oh, I'm glad to hear that you're doing well. And also it's interesting, isn't it, that for all of us, we're discovering new things, new skills that we have, or new resources that are out there for us, even as we're in the middle of so many things having been taken away from us. We're also still finding new joys and pleasures, like walking around the golf course together.
Mm-hmm. Yes.
Yeah.
And so how about you, Nicole? How are things going for you in Washington, D.C.?
Yeah, I have to say that I actually feel quite blessed as well. I'm doing really well. I myself am in really good health, and I live in a beautiful neighborhood next to a giant park. So instead of going on a walk in the park once a day, I've now upticked it to 2 to 3 times a day. And there are many grocery stores that are within walking distance to me. So my personal body, my personal health has been held in a lot of grace, and I feel really grateful for that. Otherwise, just being a healthcare personnel has been a little bit stressful, although I will say that, which I should probably update this online. My father was ill with cancer this past winter and then died in January. So presently, I'm not working as a bedside nurse. I was dedicating myself to being with him in his final months. So in a way that, that's a little bit of, I feel a great sense of luck for that. I have to admit, my mother and I have spoken several times, both saying that we are grateful that he died in January and that we're not trying to juggle this pandemic and his final moments. And also for myself, just what a gift it was that I was able to be with him has really been highlighted in the past couple of weeks. So it's, as you said, learning different things has really been the name of the game for me as well.
Mm-hmm. And so you were already in this liminal space of grief, it sounds like.
That's right.
The pandemic began. And so in a way, you're having an extended opportunity, I guess, to visit the grief over your father's death, and then all of the other losses and grief that are coming our way in this time.
That's right. That's entirely right. My father was an exceptional human being, and while he was a very complicated man, we had a very beautiful relationship. And exactly as you said, I have been in a state of grief for the last 3 months, but I will say, because I was able to have a lot of deeply meaningful conversations with him before the end, I personally have described it as a state of grief and grace, because I think I got lucky in being able to have really beautiful closure with him. Which, as I said, has really been highlighted for me as I listen to friends, family, and the news not be able to have that in this moment in time. And as a friend, as a former coworker, also hold space for all of my coworkers that are working in the hospital environment and the hospice workers that are going home to home, and hearing for them what that's like, and trying to be a source of really just listening for them in this moment. So that's where I would presence myself.
Thank you so much for sharing that with us, Nicole, because it's so relevant to the conversation we're going to have today about the fact that being present to our own grief is really what helps us hold space and be present for other people and help them process their grief as well. And so it's powerful when you're right in the middle of that space and doing your own work on your own journey, and then the empathy and connection that you can have with other people is really powerful.
That's right, isn't it? When your heart breaks, and in an ideal world, it actually cracks open for more.
Yes. Well, I'm so interested that both of you have been drawn to work with birth and death at the same time. And oftentimes in this field, we correlate those, like death is the new birth. Death and birth are similar. We talk about that a lot, but you two are actually bridging the gap and working in that area. So I'm just curious for each one of you about your own stories and how you got interested in working at these two ends of the spectrum. So Amy, would you start and just tell us a little bit of your story?
Sure. Thank you, Karen. I think of birth and death as these threshold points of wonder and mystery and struggles, at times even pain, but often this really incredible place of vulnerability for many. And often the things that feel like their surface concerns get stripped away, and the essence of what matters most is pretty clearly revealed. It's a real humbling honor to be with people in both birth and death. And I think of it rather than two ends on, if I think of a linear line as if birth's on one side and death's on the other, I think of more of a ring where birth and death meet in a space together. A lot of my work the last few years has been with families through perinatal loss. working when birth and death actually do meet, even in the same room, even within the same hour, holding space for families if they know there's going to be a stillbirth, or if there's a fetal demise that's anticipated, to really help prepare as much as possible a very big container for all the emotions associated when birth and death collide. And how I got into this work, I mean, I think it's such a great question. I grew up, I'm the oldest of 7 in a big Mormon family in Utah. And I grew up in a home where birth and death were spoken about and talked about within that religious context. And I became very interested in the study of comparative religion, living in Jerusalem for part of my teen years in college, and then getting my bachelor's and master's degree, both in comparative religion. So this fascination with how people make meaning, especially how we make meaning around these really deep places of experience where wonder seems to just overwhelm the system and the heart, really mattered to me. And I ended up teaching comparative religion courses for college students and high school students. And there was one course in particular when I taught at the Lawrenceville School called Myth and Ritual. And Karen, that was one of my favorite classes because it was a way to explore how themes in mythology and themes in ritual appeared cross-culturally. So it was a mix of kind of religion and anthropology. And we would do birth and death rituals. We would look at myths around birth, creation of the world, or the creation of humanity, creation of animals, creation of plants, and then the death of these things, and what rituals existed in celebrating the emergence of life and then the ending of the physical form in terms of death. And at that time teaching that course, my sister asked me to be her birth doula, and I was able to experience the birth of my niece and then become trained in birth doula work and realized I wanted the same taste. I really, really wanted to understand death in a more direct way rather than just abstract. So I did a CPE unit training, a clinical pastoral education training at a local level 1 trauma hospital, and became very involved in the work of holding space around death and dying. And in that, all of this to say is those two places, being with people in both of these very humbling and what I would call sacred spaces, taught me where they connect and where they're different. And that has been a place of fascination and study since.
Wow, that's really beautiful. And I love your talk of the two kind of colliding together and connecting together. And it just gave me this visual image. I remember giving birth to my first child, natural childbirth. And I remember that the thought occurred to me in the middle of labor, that the veil was very thin at that point. And I remember thinking to myself, this is the closest I've ever been to death, and feeling that feeling like I'm one heartbeat and one breath away from death in this moment, as I'm in this, the travail of labor and in this state of pain. And it gave me this recognition of just the power and how profound both of those transitions are as they're taking place.
Beautifully put.
Beautiful that you were able to touch into that, Karen, really, because that feeling of death, perceived or real, I actually believe, well, I know Amy and I both believe is really quite crucial to the maiden to matron pathway. And that's part of the shamanistic pathway that birth offers to us, if you want to walk on it.
Very interesting.
Right, because it's the death of a certain identity and the birth of a new one, right? The death of the self pre-motherhood, even though she emerges intact and changed, but forever changed and forever changed with motherhood. And even when the baby dies, and I've worked with a lot of couples through the death of little ones, they are changed. They are still very much parents and mothers and fathers, even if the little one isn't physically with them. That experience does change and crack open the heart so deeply. And it's such a wound. At the same time, it's an initiation into parenthood.
Wow. And I have to get to Nicole's story too, but
you should.
what we're in the midst of right now, we're actually in the midst of this dying and birthing process right now in the middle of this COVID-19 pandemic, and we're what used to be and the way we used to live and things that we used to have, we're having to let go of, and we're getting ready to give birth to something new. But we're right in the midst of that place where the veil is thin. We're feeling the pain of it, but we haven't gotten to the other side of it yet.
Mm-hmm.
So Nicole, please share with us your story.
Yeah, I can share briefly. I was one of those lucky people that had several people close to me die when I was quite young, and sadly didn't have people around me to talk to about that or to process it. So as a young woman, I had a fascination with, well, I don't know if I would say fascination, but I had many questions about death and dying and grief and what I was supposed to do with it. And then when I was a bit of a younger woman, about 15, 16 years ago, it's a very long story, but the short of it is that I was in Sumatra and found myself working alongside a famous midwife named Ibu Robin Lim, and attended my very first birth by her side. And when the baby came out, it itself was hanging in that liminal space between life and death and looked very much like it was going to die. Thankfully, Ibu Robin Lim was able to do quality CPR on the neonate, and it remained alive. But I was quite shaken by that experience. And so the midwife and myself talked quite a lot about it in the days afterwards. And she was the one that sort of gave me my first real lesson about birth and death. So she explained to me that birth and death are a kitchen door that swings both ways. And that if you don't realize that, then you've actually bought into the trick of life. So that was quite a lot for my young mind to wrap around, but I felt the truthfulness of it when she said it to me. And then it was a couple months after that I held the hand of the first maternal death that I was a support person for. That woman hemorrhaged and bled out while I held her. So that was really the very, very beginning of my birth doula career. And in that sense, then I tell people that really for me, for better or worse, death was a part of it from the very first moment. And then as I worked for the past 15 years as a birth doula and then a labor and delivery nurse, I attended more births and more deaths. And then at a certain point in time, took a step back from working inside the hospital as a labor and delivery nurse and worked for several years as a full-time home hospice nurse and really, really loved that, but found myself missing birth. So then kind of devised a plan that I was able to work both jobs for about 2.5 years, very part-time. So I would do 1 day a week as a labor and delivery nurse, 1 day a week as a hospice nurse. And then on the side of that, teach my birth and death doula workshops. And I really loved that. And I have to say that doing them side by side on a weekly basis really taught me a lot about the other and about what that is to accompany people in their darker moments. And also kind of, I think in many ways, I learned a lot about myself doing those two jobs side by side. As Karen, I know that you also worked in hospice as a physician, and I know from listening to your podcast that we share an agreement that unfortunately our medical system really looks at birth and death in a very reductive way. Mm-hmm. They look at them as physical journeys. And what I personally know to be true is that they are anything but a physical journey, that the journey of birth and death is much more about the spirit, the psyche, the emotions, the family unit, the community. And I think that was really driven home to me when I was doing those two jobs side by side. And I endeavor to teach that when I'm teaching my birth and end-of-life doula workshop.
Well, I love hearing your two stories and how both of you have arrived at a place of kind of a similar vision in a way of seeing things the same. But how did you ever come together? Now you're co-teaching a workshop. Amy, what's the story? How did you come together to create the workshop?
Wait.
Okay.
Yeah, can I
You
take
start.
credit
You
for it?
start.
Yeah, I would like to take credit for it a little bit, but she can as well. So I don't remember technically who reached out to who first, but I know that both of us had several friends in common that kept emailing me and texting me and saying, hey, do you know this woman named Amy? The two of you feel like you have some kind of synergy and you guys should connect. And then I do believe it was me that reached out to her first. So I'd like to take credit for it, if I may.
It was you, Nicole. It was absolutely you. And I'm so forever grateful. Yes.
Yeah, well, this is my dream come true, this kind of synergy. And that's actually one of the goals I have by putting these podcasts out there, is that people will learn about other people who are doing similar work and come together. Because when we bring our ideas and our inspiration and creativity together, I think we can create something far bigger than we could do individually. So I'm just so excited that you're teaming up and doing this online course, Grief Work for Healthcare Providers, which is something I personally feel is so very important and something that's been largely missing in all of medical education. And I wanted to ask you, Nicole, as a nurse, if you have felt as well that grief training is a huge gap in your nursing education and something
That's right.
that you value as well.
Yeah, it really very much was. I was lucky enough to go to Georgetown University for nursing school. And I will say that I believe I did receive a deeply quality education from them. So I don't want to minimize that. But there really was nothing in my education that prepared me for the complex emotions and the complex situations that I would be a part of as a nurse. I think in one class, we read a memoir of a nurse that she had written after Hurricane Katrina. And that was like the extent of it, was talking about her memoir. So as I traveled on my nursing career, I was for the first 2 years, I worked in an ER during the night shift in DC, which I don't really recommend unless you're a crazy person. But I learned a great deal during that time. And then I went from the ER to labor and delivery to hospice, and then, as I explained before, back between them. And in each of those realms, I found myself really, really overwhelmed oftentimes with my patients and their families' emotions, and then my own. And personally had an experience of trying to talk to my management about that. In my first job as an ER nurse, I tried developing something that I called a code lavender, which would mean that if anybody who worked in our ER, any of the staff, whether they were a tech, a resident, a medical student, a doctor, anyone at all, could say code lavender, and we knew that that person had hit their absolute wall, and that we needed to all cover them so they could take a 20-minute break. So I was pretty aware early on. I think also I had the benefit of coming into nursing as an adult woman. So I was aware that I needed to take better care of myself in these environments and better care of my own emotional spectrum in these environments. But I felt like I was feeling in the dark. There wasn't any leadership. There wasn't a path. There wasn't a sanctuary. There wasn't a place. And that really remained true for the rest of the companies that I worked with. And not only that, but what I'll say that I also particularly realized, which was incredibly poignant and heartbreaking for me, is that working alongside residents and seeing their emotional journey is something that has literally brought me to tears. Many residents, in fact, many medical students self-report some of the highest scores in altruism. And that's especially true when you're an intern. That's your first year of residency. And I felt that in them. I would work alongside these people. They were whole, they were robust, they felt passionate, they wanted to say the right thing, they wanted to do the right thing, they wanted to learn about trauma-informed care, they wanted to know the right pronouns and make sure that they were addressing people the right way. You know, they just deeply cared about being engaged in patient care in a really beautiful capacity. And then over the course of the 4 years, I just watched them kind of wither, really, in a way, and become people that were clearly being sort of reduced by a system, overwhelmed by a system, lack of sleep, lack of eating, pressures of the system. And so in a way, it was also sort of like I was feeling this pressure and this almost sort of like internal discord in myself, but then I was witnessing it in others and feeling like, okay, so this thing I'm feeling for myself, I'm also seeing in others. So it's quote unquote, not just me. It's also them. So I began to get really interested in this idea of, you know, like, what is that? So one aspect of it is that I think healthcare workers, you know, we tend to be sort of type A personalities. We tend to be givers. We tend to be, you know, as Carl Jung taught us, wanting to save others, wanting to help others. We're wounded healers ourselves. And so what that means, though, is that then we are working in a system where we are overgivers, we are overdoers, and that system, I realized, will just take and take and take. And the system is not ever going to say to you, like, no, please don't work an extra shift, or please don't stay 4 hours longer. The system actually is going to reap benefits from you overextending yourself. And that was kind of for me when I started to get really quite interested in wanting to create something with this. And it was so obvious and natural to ask Amy to do something with that for me. So what's sort of interesting is that actually Amy and I have been talking about offering this for a year. And we were simply going to offer it as grief for healthcare workers, sort of at baseline, because we know that our healthcare system is a system that is overburdened and overtaxed already. And then it just so happened that this pandemic came about. And so now that overtaxed system is buckling.
Yes. And it's as if you were called a year in advance so that you could get your course together so it would be ready for the moment right now when it's desperately needed.
It's so uncanny, Karen. Just like Nicole said, we've been in conversation about this and have had a Google shared doc, editing, reflecting, diving in, diving out, reflecting. Okay, let's launch it in May. This was long before COVID-19 even hit the news, was in our radar at all. And then when it did happen, okay, well, what does this mean? How do we shift? Do we shift to a donation based because we want to make it really accessible? People are stressed financially right now. How do we shift? Do we integrate COVID-19 as the primary focus, or do we maintain this baseline support and then address it as equally important? It was really a lot of brainstorming because suddenly this huge thing happened in our world that deeply intersected and impacted the exact material that we wanted to cover. And we didn't change the date. We kept the date launch the same. It's just now it's launching in the heat of this difficult, like you said, contraction in our world.
Yes. And Amy, you had mentioned previously about not only are healthcare providers dealing with the baseline of grief that is always there over having patients die and the losses that are experienced in the practice of medicine, but the COVID-19 is just adding so much extra burden and stress to all of the grief that was already there.
Right. So even when people aren't dying from COVID-19, the way families grieve, the way they can be with the body, the way the funeral may or may not happen in the way the family wants, all of the grief rituals that involved community have needed to shift in the last few months. I interviewed a dear friend who's also a palliative care physician in Asheville this last Friday. Her name is Aditi Sethi Brown, and she works in palliative care in Asheville, and she has yet to encounter a COVID positive patient herself. But every one of the people she's worked with in her inpatient hospice facility who have died in the last month, let's say, have been, their families and they have been impacted by visitor restrictions, the way people need to dress when they walk in, just this hyper sense of sterility. Like, we need to be sterile to protect, and I get it. But in the face of grief, there's such a hunger to hold and to cry and to feel and to connect and to embrace for so many, and to have social distancing wisdom say, not here, not now. It's very intense for people in the throes of grief and in the experience of death that may have nothing to do with COVID-19, but everything to do with protecting the vulnerable in our society.
Mm-hmm. And I can imagine for healthcare providers too, having to wear personal protective equipment all day, like walking around with a face shield and a mask on, and gloves and a gown, and the distance that adds, this feeling of separation it adds between the provider and the patient that they're working with. I don't know, Nicole, do you have any thoughts about that?
Well, just to agree with you that it is, it's a psychic, it's an emotional, and it's a physical distance that I think harms both ends of the people that are experiencing it, which is so unfortunate.
I have seen pictures of doctors and nurses taking photos of themselves, like 8x10 pictures of themselves smiling, and pasting it on their outfit to say, this is who I am. If you could see underneath my mask, here I am. And I think these types of creative energies are really beautiful. And I think it's important to always bring forth that spark of humanity and the way we can connect, even if it's not in the hopeful way or the conventional way or the assumed way, but we do have creative powers to connect, and that's what this moment calls upon us to do. I think for me, the reason I really wanted to develop this course with Nicole is because here we have a hospital chaplain and a nurse, and both of us have known birth and death. We both have been involved professionally in these fields. Nicole's one of possibly 2 people in the whole US that I'm aware of, at least, who is training birth and death doulas simultaneously. She's training both right now. And she does such a remarkable job. So for me to be able to work with her and to know her and connect to her and love her as a dear friend and a colleague, and then say, let's design a course that's not about having healthcare workers improve their capacity to serve, but rather let's design a course that allows those healthcare workers and healthcare providers to pause and look within and consider what has been the echo of this impact of grief in my own being. How can I digest and start to integrate the grief I've known so far in my work so that I can be a healthier self, or I can make sense of what I've lived through in this experience. And now with COVID-19, even more so.
That's right. I think that the main thing for Amy and I is that when we looked at a lot of the things that's offered for healthcare workers, by and large, it is offered to them to teach them how to hold space for others. And so that was sort of the critical difference for us, and where really our passion lies, is that we specifically want this to be for healthcare workers so that they can offer the best of themselves to themselves, and ideally with our support, and that there won't be any ask of them to pay it forward. It really will just be to continually pay it to themselves.
Right. But not in a selfish, self-centered way, but in the sense of the
Right.
wisdom you started with, Karen, when you said being present for our own grief is the empathetic key through which we can hold space for others. So I acknowledge that truth. It is true. And so much great wisdom, and so many great people are helping reflect on how to hold space for others. Let us do the first part of the equation. Let Nicole and I begin to really break down, okay, let's create a course that allows that first part, being present for our own grief, that part, to be on the table.
I love it, because this, as we said before, this is the whole component that's completely missing from medical education, but it would actually change everything for healthcare providers in all areas if grief became part of the curriculum, if it was dealt with as they were in training and as they were first experiencing the deaths of patients and experiencing those emotions that arise. So, Nicole, tell us a little bit more about the course and what it consists of.
Yes. Well, the way that we've structured it is with 4 webinars. So the webinars will take place on Wednesdays from 11 a.m. to 1 p.m. And essentially they'll consist of about probably an hour-ish of us talking about various concepts. So in the first week, we'll really be outlining what does burnout look like, what does overburden look like in one's life, and how to really self-assess on that spectrum where you are. And then after sort of offering some teaching for about an hour, we'll break into exercises and then to discussion. So our hope is that it's a little bit of educational, but also a safe place of sharing and processing with each other, with like-minded people, with people that are also working within this system.
Beautiful.
Are the
go ahead.
Are the workshops recorded if people can't attend them live? That question popped into my head.
Yes, they are. Okay. So there's no requirement to attend it live. People can listen to recordings. And if there's a certain module of the 4 that really hits home, it can be listened to a few times. I mean, the recordings will be made available to all participants. And my hope is, echoing yours, Karen, when you said how it would change the culture of medical schools or nursing schools should grief work for the healthcare provider be on the table. I taught at Lawrenceville, the Lawrenceville School in New Jersey, which is a preparatory school. And some of the students who graduate are still in touch with me. Actually, quite a few folks I have come to know over the years since I've left that school who have gone to medical school or are practicing medicine. And one young woman in particular is at Brown University right now in the medical school there. And she's reached out to me this year because they had a death in her class. One of the students died. And this sense of grief was also being experienced as they'd start to do their work and their rounds. And she said, we just don't have any training. I belong to a student group. We're raising money. We're fundraising to bring speakers to us on grief. Could you come out, or can you list other people? I gave them Nicole's name. I was like, can we get some help? These are students at Brown University saying, we need support with grief. And they're willing to use their own student funds to bring teachers. And that is beautiful, and it should happen, but it shouldn't actually be, I mean, ideally, it would be the faculty who design their courses to say, this is essential. This course every freshman takes, or this course every medical student, nursing student takes. This is foundational. It's not elective, it's foundational.
And you're so right. It's a culture shift that has to take place, because I know what I encountered when I felt emotion about patients dying and was first encountering grief in medical school. The message I got was, that's wrong. You should not be feeling those feelings. You must have gotten too connected to the patient. Mm-hmm. That's wrong. And we're not talking to you about it because you shouldn't be feeling it. And so there is this undercurrent in the entire culture of medicine that we really have to shift. And maybe this experience we're going through right now will help us make that shift in a much bigger way.
That's right. Well, and not to get too, I don't want to get too political about things, but the other thing that we know is that there's also a cultural shift in our country going on, because that notion of numbing and not feeling really comes from a patriarchal viewpoint that which is the backbone of our present medical system. But just as we see that nowadays, when you look at medical school graduating class, it is actually it is more than 50% female. So I think that there's this really unique opportunity right now going on where these kind of shifts can actually be possible. So I feel hopeful for it.
Yes.
Yes, definitely. I wanted to ask you, Amy, because you've written about holding space for one thing, and you write about birth, breath, and death. Do you recommend any practices around breathing and holding space that could be helpful? Just a couple of little tips or information for someone listening if they feel like, I need something immediately right now today.
Sure. I'd be happy to offer something that works for me, that's been helpful for me, that I've used in my own therapeutic practice, and something I offer when people ask me to hold space for them in consultation. And this is a technique that connects the storytelling mind back into the body and the feeling body. So as soon as I am listening, let's say I'm offering consultation and someone's speaking to me, and I hear the crack in the voice, I remember the words that were said in that moment where emotion kind of popped out like popcorn. I let the person finish his or her sentence. And then in that pause, I'll say, earlier you said this, and I'll repeat those words. Could you tell me more? And then that gives window to say, I heard something strong there. I'm not afraid to hear more of that, instead of bypassing it, or I would feel better, because it can be scary. If I have a lot of grief in me that's numbed, that's frozen, I don't know how to feel it. Let's say if someone else comes to me and they're very raw, I want to comfort them because I don't want to feel my own either. Right. But to the extent I'm friendly with the parts of me that have been in that darkness, in that wilderness, in that hurt, in that anger, in that rage, in that pain, to the extent that I've been friendly and gentle and accepting of those elements that make also my story, my own, I think that gives me a greater bandwidth to sit with another human being who's cracking open into these pieces and places that are hard, without wanting to make them feel better so I feel better, right? So I usually will say, oh, I heard you say this, tell me more. And then the voice will usually start to open up and there's more feelings. And I'll say, okay, where do you feel that in your body right now? Is it in the throat? Is the throat tight? Does the heart beat really fast? Are you sweating? Is there a headache? Is the belly tight? And then I'll ask them if they would put their hands on the part of their body that's feeling that the most. And then we just pause and I'll say, breathe with me right here. Just breathe into that place. Don't try to change anything about it. Let it be what it is. And breathe with me and just hold it with gentleness. All that anger, all that hurt, all that sense this wasn't fair. Why did this happen? Or I messed up. It was my fault. If I hadn't said this, she wouldn't have killed herself. All the things that could be. The echo of grief is so intense. It can be so enormous. It can feel like a howling wind that shatters every other sound. And so to be able to just touch the body and breathe is a very grounding practice in itself. But to touch the part that's most tender and breathe will often unlock a lot of emotion. And that for me is mourning. So grief, the way I like to say, I'm drawing from the work of Alan Wolfelt here, who I admire. And he'll say grief is the sense of loss in us, but mourning is the expression of that loss. And it's through mourning, whether private or public, that loss begins to reconcile into our story and we begin to start to make meaning of it. It starts to be integrated over time. It will forever change us. We don't go back to who we were before the grief. So all the healthcare workers who are in these COVID positive floors, who are dealing with people on respirators or end of life with iPads saying goodbye to their family members, these are memories that will not be taken away. They're hard memories. But if I were to work with these folks, I'd say, where do you feel that? Put your hand on your body, breathe with me. And as the tears come, that mourning starts to help integrate the grief. So it's not frozen in them and doesn't get numbed out over years. I hope that's helpful. Does that make sense to you?
Yes. And I was, excuse me, I was picturing that even as a self-care practice, perhaps for a practitioner who's been in the midst of an extremely busy day when there's no time to stop and process what's been happening, but to take a few moments at the end of the shift or the end of the day to just go within and find out, where do I feel that cracking open inside of me right now? As you were describing, where do I feel it in my own body right now? And the ability to be able to hold it and hold space for it, and hold it without judging and without trying to get rid of it, but just recognizing this is the cumulative pain from a whole day of work and from everything I've seen and done and experienced this day. And if people could process that a little bit each day as they go, it would help lessen some of the cumulative burden that will pull them under.
That's right. And then eventually the hope or the desire is not within the trauma, but in the weeks and months after the trauma or the difficulty, that they can begin to make meaning of it for themselves. And that's something that I know Amy and I feel really passionate about, is that the meaning is so specific to that person, to that individual, what they learned, what they grew, what they let go of. But it is a critical part of that being with oneself. That's I refer to it sort of as like that integration process.
Mm-hmm. So it sounds like your course is the perfect opportunity to just learn how to be with oneself, to practice together with other people, and to learn how to attend to what's happening.
We hope so.
Within.
We hope so. Yes, that's the hope. We want to offer this as a gift of our own wisdom and what we've learned so far, but knowing we're always learning, we're always growing. 10 years from now, I hope, should we meet again, Karen, and be connected and speak in either formal or informal ways, that I could say, gosh, I've grown a lot in these 10 years, and now here are the insights that have come, because I think it's a forever unfolding journey.
Yes, definitely. Well, Nicole, who is the course really for? Who do you feel is ideally suited to take the course?
I think Amy and I feel pretty clear that it's really for anyone working within the healthcare system. And by that, I mean the cleaners, the techs, the medical students, the nursing students, the bedside nurses, the managers, the directors, residents, physicians, inpatient, outpatient, really anyone. And also, to be clear, it's, not just for the people that are working on a COVID floor, or not just for healthcare workers that are specifically working side by side with COVID patients, but also for other healthcare workers, because what we know is that, limbic resonance is not just who you are around physically, it is also who you have a cohort with. So, for example, the way that I don't know that this is true, but I'm going to use it as an example. I don't know what the cases of COVID are in the state of Texas right now, or the state of Kansas. But let's just say that perhaps nurses there are really not inundated with a lot of COVID patients. But of course, as a nurse watching the news, and you're watching your other fellow nurses go through what they're going through in New York City, your own heart is going to break. You're going to feel sorrow through the limbic resonance of a cohort experience. So in that sense, it's really for anyone who is working in healthcare right now. Amy, do you want to add anything to that? Did I miss anything?
I think it's really well said. I think doulas, I would say the birth and death doulas who interact as supports for families.
Thank you.
Yes, you're welcome. All the people you teach, my love. Yes, but doulas do interact. And while there have been quite a lot of restrictions on their physical presence, unless a birthing person says, I can bring one person with me, let's say, into labor according to this hospital, and I'm picking my doula, most people will pick the birth partner, will pick the partner or father, if they're involved, as their one person support. So then the doula becomes more of a teledoula, a support through online support, through visual support, through FaceTime support. And that presence still, it carries limbic resonance. You're still not physically in the room, but you're still very involved in the birth experience. So this is an opportunity, whether you're working now or you have a lot of history working, and that is like a residue of grief. The residue of grief carries over years. It's not just in the moment. I teach courses on pregnancy loss, and one woman took my course, and she was a Canadian hospice worker, and she works in geriatric hospice. She said, I don't deal with birth at all, but I'm working with older women who are remembering stillbirths from 50 years ago. Mm-hmm. And I want to have more skills around pregnancy loss so I can help them process and navigate these memories that are coming up at the end of life about deaths they had known so many years ago. And I bring that up as an example that when we're talking about grief work, it's like grief lives in a limbic place where time does interesting circles and dances. It's not so linear.
That's right. That's right.
So true.
And I also want to emphasize what I said about it being as well open to medical students and nursing students. Just last weekend, I wrapped up my teaching just for this semester for the Johns Hopkins nursing students. And many of those students are graduating in May and going into this system that they are now every day seeing on the news just how very broken and unsupported it is. So that carries its own fear and grief in it as well. So we feel really open to the people at the beginning of this journey.
And it's interesting. I'm glad you mentioned the term limbic resonance, and that, it has a much broader radius in a way, touching all of us in certain ways. But my husband and I are both physicians, both retired now from medical practice. And every day we're hearing stories about our colleagues out there on the front lines and what they're going through. And we were just talking yesterday about we feel grief and guilt that we can't be there helping. We have this sense of helplessness ourselves, that we're here observing and witnessing all of this, and we feel the pain of it, but we can't step in. We're not in a place physically where we could even come out of retirement and go help with what's happening. And so you just reminded me that it's really important for us to remember we're still part of the resonance, and the fact that we share in the grief and we feel it and we feel what our colleagues are going through is that it's actually important. And what we can do is hold space with all of that ourselves.
Yeah, thank you for sharing that, actually, Karen. Thank you for being vulnerable. Yeah, it is. It's really critical.
Yeah. Well, tell us, Nicole, just a few more details. I know that you offer continuing education credits, which is really important for people to know. And then tell us again the dates of when it starts, how people can sign up, and all of that good information.
Absolutely. They can sign up by going to the fabulous website of my dear sister, Amy Wright Glenn. The website is birthbreathanddeath.com. And if they go to, there's a drop-down menu for online courses, and they'll see this one titled Grief for Healthcare Workers. And indeed, we felt in this time that we wanted to offer this to our community. So it is donation-based. So I'd like to emphasize that. We won't turn anybody away for lack of funds, but we do hope that people can find a way to make some kind of energetic exchange. And then in addition to that, we are offering, or I'm offering, nursing continuing education hours. So if someone does want that, we have a total of 9.6 nursing CE hours. And there is a fee if someone does want to get those nursing hours. Otherwise, the dates for the official webinars will be May 6th, May 13th, May 20th, and May 27th, each day from 11 a.m. to 1 p.m. And again, as Amy said before, they'll be recorded. So if someone can't attend live, that's also fine. And we will also likely create some kind of online community for them. I know most of us have a love-hate, mostly hate relationship with Facebook, but for cohorts for online courses, it really is quite helpful for processing and sharing and asking questions in between the webinars. So we'll likely create some kind of online community like that just for the people that are in the course with us. And in addition to that, I'd actually just like to highlight, because Amy is so fabulous, that Amy also, through her website, has been offering something called Holding Space for COVID-19, which is just a circle of the community that she's created. I'm sure she can tell you more about it, but I just wanted to highlight that as well, that if someone felt that this course isn't speaking to them for some reason, that there are other things on Amy's website that are beautiful.
And that reminds me, Amy, what about your books? I know you have a book, Holding Space, on loving, dying, and letting go. And where can people find your books?
Well, first, let me thank Nicole. Nicole, thank you for saying that. That means a lot to me. And Karen, thank you for asking about my writing. I think writing a book is like giving birth. Mm-hmm. And usually we like to talk about our babies. So I really went through a great labor for both of those books. A lot of editing and learning and growing and research and writing, and many, many hours when my son was asleep late at night. And the second book is published by Parallax Press, which is a Buddhist publishing company that Thich Nhat Hanh founded, and it's based in San Francisco. And the first book I published on my own. I self-published my first book, and the second book is through Parallax. So one could order it directly through Parallax. It's also through Barnes & Noble, through Amazon, and through different bookstores. I've seen it in different bookstores. So it's available. And I think it's important to say that the term holding space is not one I coined. It has existed before I wrote my book, but it's a term that grabbed me. And whenever I read different theories on it or perspectives on it, I felt really moved by this notion that holding space is the power to be compassionately present with what is. And that's pretty much how I define it. And if I had to put it in one sentence, it's the power to be compassionately present to what is. And it's pretty easy to hold space for things when they're pleasant. When what is something that we would embrace with open arms. It's much more challenging to bring compassion and presence to difficult things. And sometimes holding space will mean having very clear boundaries. I want to make sure people understand that it's not just this open-armed, open-hearted, anything I welcome experience. It's like I will hold space for my own internal emotions, but if someone is actually threatening me, right, then the compassionate thing to do would be to disarm the threat and protect my own self or my children or my community. So it is a powerful presence. It's not just a compassion that's soft without edges. There's the power to also hold space with awareness around healthy boundaries. And that's what I do hope people take from our course, that we want people to have the work of being present for our grief will allow people to be clear about, this doesn't work for me. This is where I end and you begin. To have a sense of boundaries is so important.
Yes.
And I feel that what we're being called to in this moment by this pandemic that the entire world is experiencing at the same time is that very idea of learning how to hold space. How can we be compassionately present with what is right now, right here in our lives, and simply sit with that? And that's one of the tasks we all have, and one of the things we're being asked to learn.
Right. And at the same time, having these interesting and strange boundaries that say, when you go shopping, you actually stand 6 feet behind the person in the line in front of you. Or when you take your child to the park and they want to go play a pickup soccer game, you say, sorry, buddy, you and I are playing soccer. And to explain that these boundaries exist because we care, right? Because at least right now, that seems to be the best way to protect each other from a highly contagious virus that may not make me that sick, but it could make my grandmother very, very sick, or my elderly neighbor very sick. So, or it could make me very sick. I don't know what it would do in my system. And I think that is true. We're learning to be compassionately present with what is, but also to recognize certain boundaries are really important right now. And even if they're really uncomfortable, to sit with
That's
that
right.
too. Yeah.
And what a society would we live in if everybody actually understood that all boundaries are always because we care?
Yeah, I love that. I love it because I think our common notion is that we put up boundaries to shut other people out because we feel threatened by them and we don't want them near us. But to imagine the boundaries we're creating, I had that thought the other day as I put a mask on before I went to the grocery store, that I want, as I look at other people with my mask on, I want to be conveying to them, I'm wearing this mask because I love you and I care about you and I want you to be safe. And that, how much better is that than I'm wearing this mask because I'm afraid of you and I don't want you to come near me.
That's right. Or I mean, even just, if you'll forgive me to make that analogy, and what if that could also be then how we start thinking about all the boundaries in our life, you know, telling a friend, no, you can't come to my dinner party if you're drinking that much. I'm making this boundary because I love you.
Wow.
Right. I think it could be both. And I think it does make sense to honor some of the darker energies too, that say, I'm scared. This is scary. This situation scares me. But bringing fear to the good company of wisdom and discernment and love, that fear can be welcome to the table of our, quote, maybe more enlightened emotions, but it still exists. At least for me, it exists. This experience has been scary for me at times. I've woken up at 2 a.m. with a sense of, oh my God, what's going on? Okay, breathe, Amy. And I just practice my own techniques because I need to.
Yeah. Well, that's a really good point, that caring for ourselves means it's okay for us to feel a need to protect ourselves. It's okay to self-protect, and that's okay too. And that doesn't in any way mean that we wish harm on other people. It's that we need to protect ourselves at times.
Mm-hmm. Karen, this has been such a great conversation. I know you may have a few more things, but let me just pause and say thank you. Thank you for welcoming us onto your podcast. Thank you for all the years of service that you've given this planet and the people who've known you, and that you continue. And when you said you and your husband were feeling the grief of not being on the front lines, I would say you are, in just a different way. By doing things like this, lifting up the work of your colleagues and yourself in this time, I see you very much on the front lines of making big changes. So thank you so much.
Oh, thank you. Thanks for saying that, Amy. That's actually really helpful to hear that perspective. And I was just thinking how grateful I am right now for technology, which is allowing the three of us to have a conversation, though we're all in different places, sheltering in place in different places. It's allowing the two of you to come together and create a course that you can offer online to people from everywhere and anywhere who need your course. Like it's actually, we're really blessed right now that we have these advantages and this technology available to us, it's allowing us all to do the work that we need to do right now.
Yeah.
Yes.
Yeah. And I really want to thank the two of you for coming together to create the course and offering it at the perfect time for listening to that call a year ago to start working on this so that it would be available for this time, and then for sharing with all of us. And just before we go, is there anything else that either one of you would like to say or that we didn't cover?
For me, no, just that I love you, Amy. It's nice. This is our first interview that we're doing together, so I'm aware of the love I feel in my heart for my sister from another mother.
Thank you. I feel similar. I feel so much adoration for you. It's just such a joy to know you, Nicole, as a friend and as a colleague. I'm really looking forward to working together and creating this as a gift to those who've been in the systems of care providing, who need to also pause and go inside and nourish and nurture their inner worlds. So that's all. Karen, thank you so much.
Oh, you're so welcome. And the resonance between the two of you is palpable. So this is going to be a very powerful course. And I'm excited for excited for everyone who gets to take this course. And I hope it's just the beginning of changes in all of our education for healthcare providers in every area. So I'll say it one more time for listeners. Go to birthbreathanddeath.com and search under, is it online courses? And you'll find the grief for healthcare providers there, and sign up for this wonderful course. So Amy and Nicole, thank you so much for taking time out and joining me today. And I'm so excited. I want to talk to you after the course to hear all about how it went.
That'd be fun.
Let's do it. Yeah, let's do that.
Yeah, for sure. Well, stay in touch, stay well. May you and all of your loved ones be blessed, and hopefully we'll talk again in a month or so.
Thank you, Karen. Thank you, Nicole.
Yeah, thank you, hon. Okay, bye.
Bye. I hope you enjoyed my conversation with Amy and Nicole. And as you could gather from my comments, I'm really excited about the course they're teaching. And particularly right now during this time of so much stress for healthcare providers and so much cumulative grief with very little time to process all of it. And so if you are a healthcare provider, I urge you to sign up for their course and participate in it. Also recommend it to healthcare providers you know who might benefit from it. And remember that you don't have to be present at the time the workshops are being held. You can listen to them any other time when that might be convenient for you. As far as one of the takeaways that I enjoyed is talking about the fact that we're really learning about boundaries. On the one hand, how do we have healthy boundaries that are healthy not only for us, but for the other people around, and viewing boundaries as a way of caring about other people. I think that's something important for us all to remember. I think we're feeling a little sad because these boundaries that have been erected around us are making us feel isolated and separated from other people. But once again, our love can transcend and penetrate all of those boundaries. So the love can still be shown. And it's not limited in any way by the boundaries that are present, but the boundaries are there for safety and for care. So I hope this work that I'm doing right now is helpful to you, whatever you're experiencing. I realize some people might be listening to this far into the future and wonder, what was going on? What are these people talking about? But this is an unprecedented time. It's a time that will go down in history, and we are participating in it day after day and watching it unfold before our eyes. And there's something rather amazing and miraculous about all of that. I hope that you and all of your loved ones are well. I hope you're safe. I hope you feel surrounded by love. I'm sending all my love out to you. Tune in next week for another episode of the podcast. And don't forget about the stories, Love Over Fear, and also the vigil that I posted for April and will continue to post once a month. So until we're together again, remember that we're here for love. So face your fear, be ready for whatever is going to happen next, and it's changing every single day, and love this life that we're all sharing together. Bye-bye.